Good morning and welcome to our webinar. We have part of the Medicare team here with you today. Myself, Christy Wilbert, VP of Medicare Offerings, Karen McDaniel, our Director of Compliance, and then one of our agent support specialists, Samantha Purcell. We're all going to go over some ways that we are here to help you prepare for AEP and just kind of give you a checklist of the things that we want to make sure that you're doing. It's on your checklist, it's in your radar to get done, hopefully before our conference. We love to have everybody be well prepared and ready to go, and that's kind of the final push to lead you successfully into the AEP. We know there have been a lot of questions out there about the compliance changes, so that's why we have Karen with us today. She's going to go over a lot of them for you. And just so you do know, we are recording this webinar, so it will be out on our calendar after the fact for you to reference back or watch at your convenience if you have to jump off for a call or a client. There is an area to your right that you'll see that there's a chat box, there's a question and answer. We don't have any polls today, but there is nice handouts for you that Karen put together with our marketing team, so feel free to save those. And without further ado, we're going to get started today, so thanks for joining us.
So good morning, everybody. I'm going to lead it off with the compliance updates. Last year, CMS really kind of threw us for a loop with the call recording. This year, they're not too harsh on us, but just the main overview of the big changes for this year. If you sold Medicare prior to 2018, a couple of these will look familiar. Educational events, you are not allowed to discuss any benefits during an educational event. When you're marketing an educational event, you must list that it is educational only and no carrier-specific benefits will be discussed during them. They do not need to be filed through CMS or the carriers. However, some of the changes that CMS threw at us this year is for 2024 is that you are not allowed to conduct a sales event after an educational event within 12 hours of that event in the same location. Prior or this year, you were allowed to accept scope of appointments and set up marketing appointments during an educational event. In 2024, you will no longer be allowed to do that. You will, however, be allowed to collect business reply cards or permission to contact cards if the beneficiary requests them. Marketing materials, anything that is listing a benefit, as listing a carrier, it has to be approved by the carrier and then it has to be approved by CMS. We don't really have a lot of agents who create these pieces. And the carriers are doing it for you. So the best advice that I can give you is use the carrier pieces. They've done all the heavy lifting for you. And I think Christy would agree with this, is instead of pushing the benefits and the carriers, market yourself. Market why the people should be working with you and not necessarily what carrier, because the carrier is the same carrier that agent next to you is offering. So really market yourself of why the client should be working with you as their local expert in the Medicare space. Scope of appointment. Again, if you were working in Medicare prior to 2018, this one is not new. They are bringing back the 48-hour rule. So what that means is that prior to sitting down with a beneficiary, you have to have the scope of appointment signed 48 hours before that appointment. There are two caveats to that. The 48-hour rule will not count if it is a walk-in appointment, a true walk-in appointment. So if you're just sitting in your office and somebody walks in and they say, hey, I need to talk to you right now about Medicare, you can go ahead and have that scope signed and complete the appointment. And it is also is not valid, or it is not required if you were in the last 4 days of an enrollment period, not the end of a month, but an enrollment period. So for instance, if somebody is in their initial enrollment period and their birth date is, or their birth month is August, but they don't come to you until November. You would have those last 4 days of November. If they come to you the last 4 days of November, then you could go ahead and get that appointment in and go ahead and submit the application. The scope of appointments are valid for 12 months. However, if you get a scope signed now for somebody's initial enrollment period and you submit an application and then these people come to you for the AEP, you would need to get another scope signed. So the scope is only good, it's valid for 12 months, but it's only good for one enrollment period. But if that person would come to you and they're in their initial enrollment period now, if they don't enroll in anything, but then they come back to you for the AEP, you could go ahead and use that scope. Medicare name and logo. This isn't really a brand new one. You do have to get CMS approval before using the Medicare name and logo on anything. If you have the Medicare name in your business, I would strongly suggest possibly changing your business name. There hasn't been anything sent down by CMS saying that there's going to be any kind of fines for doing this, but I would look at getting your name changed if possible. Door knocking, not a new one, but they have they're upholding their prohibition on door knocking. You can't go just randomly knocking on people's doors to see if they want to enroll in Medicare. A business reply card or a permission to contact is not an open invitation to go visit somebody's house. You are only allowed to go to somebody's home if with a pre-set appointment. Call recording, they eased up a little bit on the call recording this year. It was every single call that you had with the beneficiary had to be recorded. Starting on September 30th, you will only need to start recording sales and enrollment calls. So that what that means is you are talking about the plan benefits, you're doing an enrollment over the phone, those would need to be recorded. If you are only setting an appointment call or a beneficiary calls in and they just have questions, on the plan that they enrolled in, that would not need to be recorded. They have said that Zoom and FaceTime calls, the audio portion would need to be recorded. I did not really get a whole lot of pushback after the call recordings were starting to be done this past AEP and the rest of the year. I have had a lot of agents actually call me and say that having the call recording did save them from getting a compliance complaint. So if you're comfortable recording the calls, every call, you can go ahead and do that. There's nothing saying that you have to stop recording the calls. As long as you get that client's permission, you can go ahead and continue recording the calls and saving them. The biggest change this year is the disclaimer that you have to have on all marketing pieces. Again, marketing pieces. So anything that is listing carrier specific information, benefits, premiums, carrier names, that is where you have to have the disclaimer. And you also have to list the disclaimer in the first 60 seconds of a sales and enrollment call and on any client-facing websites. If you're just sending out your AEP letter to your client saying, it's the AEP, you need to call me and set an appointment, you do not have to have that disclaimer on there. If you're just sending out pieces about yourself, you do not have to have that disclaimer on there. You have to add the state health insurance program on as a resource on that disclaimer now. And you have to also list the number of plans and products available that you are currently offering. So I have on the screen there the two different disclaimers that you would have to use, whatever one applies to you. The first one is really going to be the one that's going to apply to you. You are a TPMO, a third-party marketing organization, and you do not sell for all of the MA organizations in the service area. I know that you might think that you do, but there are carriers out there that do not allow agents to offer their plans, such as Elixir and the institutionalized United Healthcare plan. they don't allow agents to sell it. So those are plans that you don't sell. So really the first disclaimer is the one that is going to be applicable to you. One good thing about the Medicare Now for 2024 is when you go in there, it's going to tell you on there how many plans or how many carriers and plans you offer. So when you're talking to somebody, it's going to be right there on the screen for you. You don't have to do the math. Where it could come into play is if you are sending out a marketing piece and you don't know exactly, what area that person lives in, you're going to have to or you don't know exactly where the people that this marketing piece is going out to, such as a website, you have no idea what number to put on there. So waiting for some more guidance from CMS as to how to calculate that number. We're hearing that you could just put a national number, like nationally I offer 15 plans, and nationally they offer 156 56 plans. It's still a little bit early. I know it doesn't seem like it is with all the certifications coming out, but CMS is still working on some more pinpointed guidance of how you should list that on your website. I did get a couple questions here. If we were to obtain an scope now and we do not enroll the bishop, yes. So if you can get the scope now and use that for, and if you get the scope now and you don't use that for an enrollment, you can use that for the AEP. Yes, so if you send out the electric scope now and you have it on file, as long as it's not used, you can use that scope for the AEP. That's all the questions I have right now. I will be on here the rest of the webinar. So if there's any other questions, please feel free and I will go ahead and answer them at the end of the webinar. I'm going to hand it over to Samantha.
All right, everyone. So we're going to start with your preparation. The AHIP is a big one. It's been available since June. The 2024 AHIP counts towards the remainder of your 2023 selling season, so that's a good thing to know. People always ask for a promo code, but there is no promo code. The discount is through one of the listed carriers. We have them on our site. It's like Aetna, Geisinger, Humana, United Healthcare, WellCare. They all, if you log in through their portals and take AHIP through their site, when you check out, you should see the $50 off. So you'll see the total of $125 rate. So the reminder to the Gemini elite level partners with us, they're going to be reimbursed. So if you just submit your receipts and your certificate to us, you can get fully reimbursed for that. All the certifications are going to be available as they're going out. We're updating our website. So I'm going to screen share here. That way you can see where on our website they are. So under the Aries tab, you're going to go under the AEP resources, and it's going to be certification links for 2024. So you'll see this, all the carriers, and then with your contracts and what you want to get certified with, what's available now, what's coming soon, if any of the benefits are out, those are listed here as well. So we did add another point to this area with the asterisk here. So we had a lot of questions. We did have a flyer that recently went out for certifying for 2024, if that's going to allow you to sell for the remainder of 2023. So you can go down and kind of look for the carriers that have this asterisk. If you have any questions with that, we do have a quick reference guide for you that I'll touch on in a little bit. So there's that, and let's go back to the slides. So just reminder for the cutoff for the renewal commissions, you want to make sure you get your certifications complete before the end of the year for 2023. That's a big one. And also, so you're ready to sell for 10/15, We recommend certifying as these carriers release these certifications. So keep checking our website, go to that link and just see what's available to take it as they come out. That way, you know, you're ready. Talking about ready to sell, we are doing the best that we can to monitor as the carriers send us the reports who's completed the certifications and update them appropriately. You can always check under my URL to see where your status stands per carrier. That does reflect again in Medicare Now. So as you're ready to sell, we update it in Medicare Now, and then you should see your available plans there to write them in the platform. If you didn't know where that was, we'll go back to the screen, and you're going to go under Departments and Medicare Offerings. Or I'm sorry, you're going to go to Agent Resources and My URL Agent Center. And that's where you're going to be able to see where your contracts are listed. It's an orange tile for you. Check. Oops. Well, it's being a little slow. So you'll go under there and then it'll be my contracts here. So you'll click there and that'll show you where your statuses stand. So going back to the slides. So the next one we're going to hit is what you have 24/7 access online to. Obviously, our website is a wonderful tool to have for, you know, anything that you might need referencing, whether it is like any events that are coming up, old, new. Our training library has all of our old webinars and anything that's coming up. So you can sign up for those there. The quick reference guides I did touch on. We sent out that flyer for the, you know, year-to-year selling if the certifications transfer over for the remainder of 2023. There's all of the broker support member services there, and where to send applications, underwriting guides, and all of that is going to be under this as well. So we'll go back to the screen share. I'm going to just show you where it is under Departments, Medicare Offerings, and then Medicare Tools. This is going to have a lot of your quick reference guides, any extra benefits, guaranteed issue rate reference guides. We get a lot of questions on those things. So just making sure you have all of these, scope of submission, scopes, all of that. So let's go back. Medicare Now, we are going to kind of deep dive into that a little bit further in the next slide, but that is 24 hours, 24/7 for you. You can go on there, run quotes. That's going to be under our quoting tools. So you're always going to be under the Areas tab for Medicare Offerings, and you'll see that for the 2023. You'll be able to toggle for 2024 this year. So again, that'll be in the next slide. Christy will go over that with you. But for the supplements, you're going to have that here. So CSG is the other quoting tool. We want to make sure that you have the quick tips of also utilizing that market analytics tab. When you're in there running a quote, you can see, you know, all of the rate history, and then you can also apply the household discounts. There's a tab for that as well. So don't forget about those little quick references and quick helpful tips while you're under that quoting tool. You can also search for any SNP plans on from our website. So you just would put in special needs. I'm spinning, so I wanted to show you, but I can't get into the quoting tool just yet. Okay, so here we are. I'll share it with you. Oh, I don't know if it's going to let me. Okay, well, the tabs are in there for you. So if you need help or assistance, always call the Medicare Offerings department. So we're here to help you run those quotes and look at all of that stuff if you need to add any of those tabs. And then again, for 24/7 access online, you know, if it's during the night when we're not here in the office to call and ask. Medicare.gov is a great tool to use to reference if you have any questions for, enrollment timeframes or anything. They have a lot of the information online there for you. So I will turn it over to Christy at this point for the next half.
Thanks, Sam. Karen, you do have some compliance questions out there. Do you want to just get to them quickly?
Sorry. Hit it twice. I was going to wait to the end.
Okay, I'll keep going then. All right, just to keep going on Medicare Now and its capabilities, in case you're not using it now, we really encourage the use of it. By our enrollment numbers that we get from Connecture DRX, because that is the vendor that leases us, the opportunity to use this quoting tool. It's not something that URL designed. Connecture DRX, who's been around for a very long time and used to run Medicare.gov quoting, actually is the, back-end support of all of this. So they are continuously bringing out new things and making this tool better and better. We have gotten some great feedback from a few of our agents on even better ways to improve it. So most of those things they are working on now. Is it going to be done by AEP? No idea, but they are working constantly on improving the site. We're really excited about what's to come. But for right now, as Sam said, you have 24/7 access to it to run quotes. It's storing all your client information. That includes doctors, that includes prescriptions. It does have a call recording. It does have an e-scope option, so you can send that out 48 hours in advance or even prior to that. As we got questions, you can send it out now if you want to. For the AEP, just get ahead of it. All of it can be stored in there. Most carriers at this point aren't asking you to send the scopes in, as Karen has that guide on there for you on who still is requiring them. But, that could also change. More to come at our conference as we keep learning more and more about what CMS means with all of these changes. And hopefully we get some more details. But you can quote and compare up to 3 plans with 3 pharmacies. There is a MyMedicare.gov blue button on the prescription page, which does link to Medicare.gov. If your client does have a Medicare.gov set up already with their drugs, no reason to redo it. They could just load automatically. There is alternatives for off-formulary drugs, which they give you on the website as well. If there's like some pharmaceutical thing out there that you can get enrolled in or discount card. As Sam mentioned, there is a SNP filter, which is helpful if you're looking for that. They are working on getting Medicaid eligibility on Medicare Now for next year, so fingers crossed that gets done. Most companies that have HRAs are on the website as well. It's either built into the application process or they actually link you out to the carrier-specific website. That seems to be what's most popular. You're linked out of the program, but that's all in there for you for ease of use. More things to come. You will on 10/1 have access to the 2024 plans for quoting. So they give you 15-day or 14-day head start if you want to get in there and change anything or run any quotes before you can take applications. A great thing this year is you'll actually get to toggle back and forth. It is on the quote results tab. You'll have the opportunity on the top right. There's a little button where you'll get to see back and forth between this year and next year, which is really helpful. So you don't have to go out, use a separate link like you had to do in the past. So huge improvement. It is going to show plan IDs when they're enrolled, which is great. So when you go in next year for 2025 AEP, you're going to have the plan number and everything, if that can be helpful. And some carriers are even going to be providing status updates. So that's totally new. If the carrier provides us that data, we'll provide it to you. So when the feed comes back, if they have accepted the application, it will say that on your client detailed page. So some great things to look forward to. Why I had all of you, I just wanted to take an opportunity to discuss some marketing tips for AEP. It's extremely important that you are sending out pre-AEP retention letters and because all of your clients, if they are on a Medicare Advantage or prescription drug plan, are going to get an ANOC letter, the annual notice of change. They're going to call you, be confused. What does this mean? So just get ahead of that. We suggest late September that you send those out at the very latest, just to let them know, that you're their agent. You'd be happy to answer any questions, schedule appointments, ask for referrals. That's the huge way to grow your book of business, is by asking for referrals. And that's always everybody's goal, right? Just to not have to do any marketing anymore and just live off referrals. That's the golden egg. So you don't get there if you don't ask. Set up AEP educational seminars. So seminars are most successful during the annual enrollment period. I hear that time and time again from agents that do it regularly. Schedule them at libraries, schedule them at diners, schedule them at hotels. You may use our office space, whatever is convenient for you. Get your clients in a room together to have a meeting. Have them bring a friend. Besides seminars, the other most important thing to do is the personalized marketing letters. So if you're doing something like that, you should see a good return on your investment, because it's low cost, it's easy to do, it's just time consuming. So anything that you're willing to put blood, sweat, and tears into usually comes back to you tenfold. So that's something important to remember. If you're working hard, it's going to work hard for you. Work with some local businesses and offer them some free items branded to you. As Karen mentioned earlier, I'm a huge advocate for not branding anything to carriers, but branding to yourself. You want to be the household name. It's your name that needs to be talked about, and that's important. So make sure that you are saturating your local community before you expand off to different areas. I know right now it makes it very easy to go into other counties or go into other states because everything is online and easier to sell online. But that doesn't mean that's the best way to grow your business. When you saturate an area like your hometown, you want to get everybody to know your name. You want everybody to use you as a referral before you expand your market. It helps to continue to grow that way. You're not going to get onesie, twosie referrals or people to call you. You're going to get, they're going to come a lot faster to you. With the local business thing, anything, here in Lingelstown, we have like a little square where there's businesses up and down the street. Why not, work with them on items that they give away, they use. If it's a Legion, I'm sure they have, little cardboard coasters that they use. Why not have your name on them? If it's an eyeglass doctor, why not give them glass cleaners with your brand on them? If it's a coffee shop, maybe you can pay for the coffee cups. Any way that you can get your name in there, and it's at low cost. And once they're gone, they're gone. If they did well, buy more. If they didn't do anything for you, hopefully it wasn't a huge investment fail. The little things, I think, make a huge difference. You don't need to have a huge billboard or be on a bench or anything like that. Just continue to build your brand and work with the community. Build your social media presence. Social media continues to grow. Facebook continues to be targeting more and more of the senior generation and demographic. They're on there seeing their grandkids. They're enjoying communicating back and forth with old classmates. So make sure that you are marketing on Facebook. You can do it for free. There's pay-per-click ads. Sarah Ortega, who's one of our marketing specialists here at URL, and I are going to do a whole webinar on Facebook ads, because it is easy to do, but it can become overwhelming if you're not organized in your thought process and what your end goal is. So look forward to that. And then also a great area to grow is YouTube. You can easily create a YouTube channel. Videos can be short. A lot of people are doing podcasts on YouTube, cover all kinds of different topics, because when a senior is going online to get information on Medicare, they're more likely going to watch a video than read an article. So you want to make sure you have videos out there for people to watch, and multiple of them, because if your name keeps coming up, or they watch a great video that you put on, they're going to go down the list of, hey, what else did this person put out? And if you seem like an educated resource, that's just another reason that they're going to come to you at the end of the day as their agent. Commissions. I thought this was a good topic to hit just because we do get a lot of questions, especially a lot has changed with commissions. No more carriers are paying lump sum on the renewals in January. So you're seeing like less and less big payouts in January because they're spread out throughout the year. So I just wanted to talk about them quickly. Only if a individual is brand new to Medicare, has never been on a Medicare plan before, are you going to get the full commission. So even if they've been on a PDP and a MedSup, that PDP was in CMS before. So if you write them on a Medicare Advantage for the first time, they still are not new to Medicare. Okay, so that is a renewal commission. That's not a new to CMS, new to Medicare commission. So that's the difference between brand new and renewal. So during the AEP, if somebody's been on any sort of plan and you're writing them to a different plan, that is a renewal commission. When you're new to Medicare or CMS, you are paid in lump sum. It doesn't matter if it's January 1st was their birthday or December 1st. It is the same amount of lump sum payout that you get. Now, the only caveat to that is if somebody was maybe new January with some other agent, and then you write them and switch them over. Let's just say it was a 5-star SEP in July. It's going to be a prorated full commission because that agent that had them in January is going to get retracted those, last 6 months, and you're going to get that 6 month of commission. Okay, questions about that, you can ask me or the commissions team. Same thing with prorated renewals. Okay, if an agent had it the first, 6 months, it's going to pay out to that agent till July, and then you're going to take over the renewal commission. So you're not going to get the months that it was with another agent. That agent already got paid for that. Rapid disenrollment. So when you write somebody onto a new plan, and it auto renews for January 1st, either way, they have to stay on the plan for 3 months. If they do not, your full commission is retracted. That's what a rapid disenrollment is. You can follow all of the commissions that we pay, which are the local Pennsylvania carriers, under my URL where Samantha showed you, under your agent resources tab, and then my URL, and then you'll hit the commissions tab. So any commissions we pay, you'll have full PDFs, I believe they print out as of your clients and how much was paid. For the carriers that pay you direct, those big nationwide carriers, you have to go out to their website and their agent portal to pull your commission statements. But again, any questions, we'll be happy to help you or further explain. We're getting a bunch of questions about the Maryland birthday rule. If you're out there selling a Medicare supplement in Maryland, there are 6 states that offer the birthday rule. If you aren't familiar with that, it means that every year on the client's birthday, they actually have a period of time that they can enroll, guarantee issue into another Medicare sub plan. The caveat is they already have to be on a med sup to be able to use. Am I back? Gotta love the internet. Okay, so the other, I don't know what you heard, but 30 days for Maryland. Medicaid, there's a new guarantee issue rate out there because of COVID, and they're, the last 3 years, they're doing a new Medicaid evaluation and kicking some people off their eligibility. There is going to be a guarantee issue rate for those people that are losing their Medicaid. So just make sure that you're paying attention to what Part A and B effective dates are to remember what's guarantee issue. Is it C or F or is it G? So just something to pay attention to. And a lot of plans are actually leaving the market, but we specifically wanted to mention Ascendo, which is Aetna, because we've had a lot of people using them for enrollment. They are leaving on July 28th in Pennsylvania. Pennsylvania is one of the last ones to go. They have been getting rid of other states. So we just wanted to make everybody aware. You don't want to write new people onto the plan because they're not going to get a SEP or a guarantee issue into another plan. Remember, it's a med sup. Aetna's still going to be around. So they're not going anywhere. So the plan isn't becoming insolvent, right? So the rates are probably just going to go up. That's what's going to happen. So just avoid it. Okay, get ready to reconnect with us at our Medicare Connections Conference. We're really excited to host you. We're very aware there's several conferences going on this day, so we're really excited if you pick us. We hope that if you do business with us, that you're coming to our conference. We have a great registration number of about 270 right now. We usually see about 300, so we hope that continues to increase. This is a special year for us. It's our 10-year anniversary, so we are going to have some great prizes. We're rolling out our new Power Sales University, which we're so excited to share with you. Our staff internally has been doing it, and it has been, very eye-opening and wonderful, even for me personally. So you'll get to hear a lot about that, and we're going to give away 10 memberships for that. It's a 2-year sales training. So it's fantastic. And Jim McDaniel was the one that got us interested in this. So he's going to tell us all about it that day, and he's very passionate about it. So I'm excited for him to share that passion with you. And then we have Social Security closing the day. So Frank is coming again. He's going to speak for a whole hour on Social Security. I know that's a very hot topic for everybody. Don't give him too hard of a time. He can't fix everything. He's no superhero, but we're very thankful that he's coming to spend the day with us. And all of our carrier partners will be there. We have a marketing segment, and we're going to share some things we learned from our focus group. So it's going to be a great day. And we'll have some new staff to introduce you to. So I'm excited about that as well. All right. I'll give it back to Karen so she can do her questions.
Yep. So I have 3 questions here. The first one is from Ashley. She asks if she sets up a few hours as office time at a senior housing community, is that considered a walk-in and scopes can be signed at that time, or does she have to wait 48 hours? If she's using that area as an office and people walk in, then she can go ahead and get the scope signed and do the appointment right there. Rondi wanted to know, when do you complete the scope? Is it when the client completes their portion with the date? So if you get the scope signed 48 hours in advance, the client will sign it, 2 days before the appointment, and then you'll sign it the day of the appointment. And then Janine asked, can we still state that you are independent agents who specialize in Medicare? Is that considered using Medicare name according to the new rules? No. So you can go ahead and still say you're an independent agent who specializes in Medicare because you're not misusing it in a misleading manner. You're not saying you work for Medicare. You're stating that you are an independent agent and you just specialize in Medicare, so that's perfectly fine. Rondi followed up, holding it for the AEP. No, so you would go ahead and you would complete it during the appointment, Rondi. The date that you get, the date that you have the appointment, you can go ahead and put that date on there. That's the last question. Is anybody other questions? Feel free to go ahead and shoot me an email or give me a call with any other questions you have compliance-wise. There is all the things that I went over under the handouts tab. There's a 2024 CMS final rule highlights and clarification PDF. Go ahead and review that. If there's any other questions after that, just shoot me a message and we'll get back to you.
Karen, I thought it would be nice for us to clear up too, because there hasn't been any information out there about like inbound versus outbound phone calls and one being excluded from the 48-hour rule. Because on Facebook right now, there's huge conversations on those big Facebook groups. We all know who they are, because they have call centers. So they're trying to make it okay for call centers to like avoid the 48-hour rule. So my suggestion would be don't get caught up in all of that, because, you know, obviously they're tunnel vision to what they need to happen. I don't know if you have anything other to say than that.
You mean as far as like, do you need the scope sign 48 hours if it's an inbound or an outbound? You still have to have it has to be 48 hours, inbound or outbound, doesn't matter.
Yep, I just wanted to clear that up because that's the huge social media presence right now. Just try to ignore all of that. And as a marketing person, not a compliance person, so, you know, listen to Karen, follow the rules, but don't get all caught up in that, okay? Because if history repeats itself like it has with the recording calls, everything is so tight in the beginning leading up to AEP because CMS puts out these new rules and the carriers go really strict because they are the ones that are held accountable at the end of the day if they're giving us wrong information as the agents. So they have to make sure that they keep it as tight as possible. And then, you know, come January, CMS is going to release something and be like, oh, we didn't mean you had to record your appointment setting. It was only the enrollments. So like, just do the best you can. We are here to support you. We know it's a lot of changes. It's been quite the whirlwind the last couple of years with CMS, but they really are trying to help the independent agent, not harm. I think that's very clear. But it's been a lot, and we definitely empathize with you on that and sympathize. So, all right, that's all for today, folks. And we'll catch you at the conference if we don't get to see you before that. And thank you for your time. We appreciate your partnership and choosing to work with URL. So have a good rest of your day.
Thank you.
Bye-bye. Thanks.